Before we begin, I want you to know something. This story has a hopeful ending. There will be hard moments, but no darkness without light. These are real pregnancy stories shared with permission, told by a gynecologist who lived them. They are for support and education, not medical advice. If you are going through a complicated pregnancy right now, you are not alone. Let's begin. You know, after 30 years of delivering babies, people often ask me if I ever get used to it. The crying, the joy, the fear. And I always tell them the same thing. Most deliveries, yes, they blend together after a while. You do your job, you bring a life into the world, and you go home. But there are patients who leave footprints on your heart. Women you carry with you long after the scars have healed, and the babies have learned to walk. Anastasia was one of those women. I remember the first time she walked into my examination room. She was 26 years old, wearing a loose sweater that couldn't quite hide the small curve of her belly. She sat down on the edge of the chair, not leaning back, like she was ready to run. And she had that look. You know the one. It's the look mothers get when they have been told too many times that everything is fine, but their bodies are screaming otherwise. She was 26 weeks pregnant with her first child, a baby boy. She told me her name, and then she paused. I waited. Sometimes silence is the best question. Then she said, "Doctor, I think something is wrong with my baby's growth." Other doctors had told her she was just small, that she was anxious. That first time mothers always worry, but Anastasia knew her body. She knew her belly hadn't changed shape in nearly a month. She had stopped buying maternity clothes because what was the point when you weren't getting any bigger? I listened, and then I asked her to lie down on the examination table. The moment my hands touched her abdomen, I felt it. The fundal height was off, significantly off. A woman at 26 weeks should measure around 26 centimeters from pubic bone to the top of the uterus. Anastasia was measuring 22, maybe 23. 4 centimeters doesn't sound like much. But in pregnancy, 4 centimeters can be the difference between a healthy baby and a fight for survival. I didn't tell her that yet. I just pressed my fingers gently against her belly, feeling for the baby's position. The baby was there. I could feel a small, hard knot that was his head. But he felt tiny. Too tiny. Anastasia was watching my face. Women always watch the doctor's face during an abdominal exam. They read our micro-expressions better than any machine. I smiled. But I also said, I want to do an ultrasound. Not the big one. Just a quick look with a portable machine. Okay. She nodded. And as I turned to get the machine, I heard her whisper something under her breath. I didn't catch all of it, but I heard the word please. That was the moment I knew. This wasn't anxiety. This was a mother's instinct trying to save her son. I wheeled the portable ultrasound machine to her bedside. The screen was small and the image wasn't as clear as the big machines in radiology, but it was enough. It was always enough to see the truth. Anastasia pulled her sweater up and exposed her belly. I remember thinking how pale her skin looked. Not the glowing tan of a healthy pregnancy, but something tired. Something struggling. I squeezed the gel onto her abdomen, and she flinched at the cold. Then she laughed nervously. A small, quick laugh that died the moment I placed the probe on her skin. I found the baby's head first. Or rather, I tried to find it. Usually at 26 weeks, the head is easy to locate. A perfect circle with a midline shadow. But Anastasia's baby was sitting so low in her pelvis that I had to press harder than I wanted to. There he was. A tiny skull. I measured it. The machine calculated the gestational age based on the size. 24 weeks and 2 days. Not 26. I didn't say anything. I moved the probe to his abdomen. This is where we measure growth. The belly circumference tells us if the baby is getting enough nutrition through the placenta. I froze the image. I traced the measurement. The machine blinked. 22 weeks. Anastasia was 26 weeks pregnant, but her baby's abdomen was measuring 4 weeks behind. His body was not growing. His head was growing, yes. The brain was protecting itself. But his limbs were thin. His stomach was small. He was starving inside a womb that should have been feeding him. I felt my own heart rate change. Not panic. Training kicks in. But a quiet alarm started ringing in my chest. "What do you see?" Anastasia asked. Her voice was steady. Too steady. I looked at her. "Anastasia, I want to be honest with you. Your baby is measuring smaller than he should be. His head size looks appropriate for his age, but his body is not keeping up. This pattern is something we call asymmetric growth restriction." She didn't cry. She didn't gasp. She just closed her eyes and pressed her palms flat against the examination table, like she was steadying herself for a fall she had already seen coming. "Am I hurting him?" she asked. "Is my body poisoning my baby?" I reached over and put my hand on her arm. "No. You are not poisoning him. This is not your fault. This happens when the placenta is not working as well as it should. The blood flow through the umbilical cord is likely restricted. Your body is trying. The placenta is just struggling." She opened her eyes. "Can you fix it?" And there it was. The question every doctor fears. Because sometimes the answer is no. Sometimes you cannot fix the placenta. You can only watch. You can only wait. You can only prepare. "I can't fix the placenta," I said quietly. "But I can watch your baby very closely. And if the time comes that he is safer outside than inside, we will take him out." "How small is too small?" she whispered. I didn't answer, because the truth was too heavy for a Tuesday afternoon. I sent Anastasia to the main radiology department that same afternoon. The portable machine is good for a quick look, but I needed the high-resolution equipment. I needed to see the blood flow. I needed to measure every single vessel in that umbilical cord. She left my office without saying much. Just took her purse, tucked her sweater over her belly and walked out. I watched her go down the hallway. She walked slowly, carefully, like she was afraid that walking too fast might shake something loose inside her. 3 hours later, the radiology report landed on my desk. I sat down with my coffee and opened the file. The images were clear. Too clear. The baby's head was measuring 25 weeks and 4 days. Nearly appropriate. But the abdomen was measuring 21 weeks and 2 days. Almost 5 weeks behind. The femur was short. The estimated fetal weight was 640 grams. A baby at 26 weeks should weigh close to 900 grams. He was barely 2/3 of the weight he should have been. But that wasn't what made me put my coffee down. It was the Doppler studies. The test that measures blood flow through the umbilical artery. Normally, the waveform shows a nice, steady pattern. Blood goes from the placenta to the baby, then back again. A smooth rhythm. Anastasia's Doppler showed something called absent end-diastolic flow. That means when the baby's heart relaxed between beats, the blood stopped moving. There was no forward flow. The placenta was pushing blood toward the baby, but during the rest period, nothing was getting through. I have seen this many times. And every time my stomach drops. Because absent end-diastolic flow is the step before reverse flow. And reverse flow means the baby is not just starving. The baby is sending his own blood backward toward the placenta, trying to survive. That is when brain damage starts. That is when we lose them. I picked up my phone and called Anastasia directly. Not the front desk. Not the nurse. Me. She answered on the first ring. "It's bad, isn't it?" I didn't lie to her. "The baby is not growing properly, Anastasia. The blood flow in the cord is compromised. He is getting some oxygen, but not enough nutrition. We need to start seeing you every other day for monitoring. And we need to talk about the possibility of a premature delivery." "How long?" she asked. "How long can he stay inside?" "Right now he is safer inside than out. But that could change in a day. Or an hour. We watch the blood flow. When it reverses, we deliver." The line was quiet. Then I heard her exhale. A long, slow breath like she had been holding it since she walked into my office. "Every other day," she repeated. "I'll be there." If stories like this touch your heart, don't forget to support this channel so more mothers know they are not alone in this fight. Anastasia kept her word. She showed up every 48 hours, sometimes earlier if the anxiety got too loud. I would walk past the waiting room and see her sitting in the same corner chair, always alone, always holding a cold water bottle against her belly to try and wake the baby up for the monitor. But here is what I didn't know for the first 2 weeks. She wasn't driving home between appointments. I found out by accident. One of the night nurses mentioned that she had seen a car in the far corner of the parking lot, engine off, windows cracked. The same dark blue sedan, parked in the same shadow. Every single night. I walked to the window on the 3rd floor and looked down. There it was, under the flickering light of a broken lamppost. Anastasia's car. She was sleeping in the hospital parking lot because she was too afraid to go home. Too afraid that if she drove 40 minutes away, something would happen in the middle of the night and she wouldn't make it back in time. Too afraid that her baby would stop moving while she was lying in her own bed and no one would hear her scream. The next morning, I found her in the cafeteria. She was eating a dry bagel, tearing it into small pieces, not really eating, just moving food around a plate. I sat down across from her without asking. "You've been sleeping in your car," I said. She didn't deny it. She didn't look embarrassed. She just nodded. "The Doppler is better here. If I feel something wrong, I can run inside. There are always nurses. There is always you." "What about food? Showers? A real bed?" She shrugged. "The cafeteria feeds me. The bathroom has a sink. And sleep doesn't come easy anyway. Not when you're lying there wondering if your son is dying inside you." I wanted to tell her to go home, but I couldn't, because I understood. When you are carrying a baby who is starving, the world outside the hospital stops mattering. Work stops mattering. Friends stop mattering. The only thing that matters is the machine, the monitor, the sound of that heartbeat. So instead, I told her about the empty call room on the 2nd floor. It had a cot, a keypad lock, a shower down the hall. It wasn't a hotel, but it was better than a sedan. She looked at me for a long moment. Then her eyes filled with tears. Not crying, just filling. Like a glass slowly overflowing. "I don't want to be a burden," she whispered. "You are not a burden," I said. "You are a mother. And mothers do not have to be brave in parking lots alone." She took the key. The call room became Anastasia's sanctuary. She moved her things in quietly. A small bag with 2 changes of clothes, a toothbrush, a photo of her mother, and a notebook. I noticed the notebook one morning when I stopped by to check on her before my first surgery. It was open on the cot. The pages were filled with numbers, dates, times, every single kick count she had done since the diagnosis. 26 weeks and 3 days. Morning session, 8 kicks in 30 minutes. Afternoon session, 11 kicks. Night session, 6 kicks. 26 weeks and 4 days. Morning, 5 kicks. Afternoon, 4 kicks. Night, 7 kicks. She was documenting her son's life in numbers. Every movement, every flutter, every roll. She told me she stopped using the phone apps because they felt too impersonal. She needed to write it with her own hand, to feel the pen against the paper, to make it real. "People don't understand," she said one afternoon. We were sitting in the monitoring room, waiting for the NST strip to print. They say, "Oh, you must be so excited to feel him move." But it's not excitement, doctor. It's terror. Every kick is a prayer. And every quiet hour feels like a funeral. I watched her hands. She was pressing them against her belly, counting, always counting. Her fingers would tap against her abdomen like a metronome. 1 tap for 1 kick. 2 taps for 2. She told me she had started drinking orange juice at 3 in the morning just to feel something. Anything. The baby's growth had stalled completely. Between week 27 and week 28, he gained only 20 grams. The Doppler studies were holding steady at absent end-diastolic flow. Not reverse yet, but not improving either. We were walking a tightrope. Every day inside meant more lung development. Every day inside also meant 1 step closer to placental collapse. Anastasia asked me a question I will never forget. She said, if I could take the food from my own plate and send it directly to him, I would starve myself to make him fat. Why can't my body just do that? Why is it failing? I didn't have an answer. Sometimes medicine has no answers. Sometimes the placenta just grows old before its time. Sometimes mothers love harder than their own biology can match. She stopped buying baby things completely. I asked her why. She looked at me with hollow eyes. I don't want to bring a crib home to an empty room. I closed her notebook gently. Then let's keep filling these pages. One kick at a time. It was 2:17 in the morning when my home phone rang. I have been a doctor long enough to know that calls at this hour are never casual conversations. Never a wrong number. Never a friendly hello. At 2:17 a.m., the phone rings because something has gone terribly wrong. I answered before the second ring finished. It was the labor and delivery charge nurse. Her name is Margaret. She has worked the night shift for 22 years and nothing rattles her. But that night, her voice was tight. "Doctor, it's Anastasia, the IUGR patient in the call room. Security found her in the bathroom on the second floor. She's hyperventilating. Can't catch her breath. She keeps saying the baby is dead." I was already out of bed. I threw on clothes, sweatpants, a jacket over my pajama top, shoes without socks. I didn't care what I looked like. I drove faster than I should have. The streets were empty, just red lights and my own heartbeat filling the car. When I got to the hospital, I found Anastasia in the triage bay. She was sitting on the edge of the bed, rocking back and forth. Her face was wet. Her lips were pale. A nurse was trying to put an oxygen mask on her, but she kept pushing it away. "The baby stopped moving," she gasped between breaths. I woke up and he wasn't there. I pressed. I drank juice. I laid on my left side. Nothing. He's gone. I know he's gone. I walked straight to her and put my hands on her shoulders. I looked into her eyes. "Anastasia, listen to me. I am going to put the Doppler on your belly right now. But you have to breathe with me first. In through your nose. Out through your mouth. Can you do that?" She shook her head. I had a dream. A bad dream. I dreamed he was born without a heartbeat. And when I woke up, the silence was everywhere. I didn't wait any longer. I reached for the handheld Doppler on the wall, the one we use for quick checks. I squeezed the gel onto her belly and pressed the probe against her skin. Nothing. I moved it lower. Nothing. Anastasia grabbed my wrist. Her grip was strong. Desperate. "Please," she whispered. "Please just tell me the truth." I moved the probe again. To the right. To the left. To the spot where I had heard him just 18 hours earlier. And then, faint as a whisper, I heard it. A heartbeat. Slow. Only about 90 beats per minute when it should have been 140. But it was there. He was there. I exhaled. "He's alive, Anastasia. His heart is slow, but he's alive." She collapsed against me. Not crying. Just shaking. Shaking like a leaf in a storm. "I can't do this anymore," she said into my shoulder. "I can't keep waiting for him to die." I held her. And I made a decision. No more waiting. December 12th started like any other winter morning. Gray light through the hospital windows. The hum of the heating system. Nurses switching shifts at the desk, coffee cups in hand, talking about holiday plans. But I knew walking into the hospital that morning that something felt different. The air was too still. Too quiet. Anastasia was already in the monitoring room when I arrived. She had gotten there at 6 in the morning, even though her appointment wasn't scheduled until 9. She was lying on the examination table, the NST belts wrapped around her belly, the paper strip slowly printing out the story of her son's heart. She looked calmer than she had in days. That should have worried me. When mothers go quiet, when they stop asking questions, it usually means they have surrendered to whatever is coming. "Good morning," I said, hanging my white coat on the hook. "He's moving today," she said softly. "Not a lot, but enough." I felt 3 kicks since I laid down. I looked at the NST strip. The fetal heart rate tracing was there, but it looked flat. Normally, a healthy tracing shows variability. Little ups and downs that tell us the baby's nervous system is working. Anastasia's tracing was smooth. Too smooth. Like a lake with no wind. I didn't say anything. I reached for the ultrasound probe. I just want to check the blood flow quickly, I said. Routine. Okay. She nodded. She didn't watch the screen. She had learned not to watch. She stared at the ceiling instead, counting the tiny holes in the acoustic panels. I think she had memorized every single one by then. I found the umbilical cord. I turned on the Doppler. The screen filled with those familiar waveforms. My stomach dropped. The pattern had changed. Overnight, the absent end-diastolic flow had become reverse flow. The waveform went up during the baby's heartbeat, but during the rest period, it dipped below the baseline. Negative. Backward. The baby was now sending his own blood backward toward the placenta. His body was trying to survive, but the cord was failing. Every backward beat was a warning. Every second he stayed inside, his brain was at risk. Anastasia, I said, keeping my voice steady. The blood flow has changed. We need to deliver your baby today. She turned her head and looked at me. No tears. No panique. Just a quiet nod. I knew it, she said. I knew when I woke up this morning. The silence was different. The room erupted into motion the moment those words left my mouth. That is how labor and delivery works. 1 second, everything is quiet. The next, nurses are flooding in, anesthesia is paged, the operating room is being prepped, and the mother is being asked to sign consent forms she never thought she would need to read. Anastasia signed everything without hesitation. Her hand was steady. I watched her write her name on line after line. Emergency C-section. Blood transfusion consent. NICU admission. Steroids for the baby's lungs. She signed them all like she was signing a grocery list. Numb. Focused. Surviving. The nurse started placing N4 in her arm. Another nurse was shaving her abdomen. Someone was explaining what would happen in the operating room. But Anastasia wasn't listening to anyone except the baby. Her hands were pressed against her belly, moving in slow circles, like she was saying goodbye. I'm going to go scrubbin', I told her. I will be there the whole time. You won't be alone. She grabbed my sleeve. Just get him out fast. I don't care about the scar. I don't care about anything else. Just get him out breathing. I squeezed her hand and walked out. The scrub sink was cold against my hands. I washed methodically. Fingers. Nails. Wrists. Up to the elbows. The orange brush scraped against my skin. I have done this thousands of times. But that morning, my hands were shaking. Just a little. Just enough to notice. I walked into the operating room. The team was ready. The lights were bright. The instruments were laid out in perfect rows. The anesthesiologist nodded at me. Spinal anesthesia was already taking effect. Anastasia was lying on the table. A blue drape raised between her face and her belly. She couldn't see anything, but she could hear everything. Then I made a mistake. A small one, but one that haunts me still. I asked the nurse to do one last Doppler check. Just to confirm the baby's position before I made the incision. Just to be sure. The nurse placed the probe on Anastasia's belly. Silence. She moved it. Silence. She pressed harder. Silence. The room stopped. No one breathed. The only sound was the beeping of the maternal heart monitor. Anastasia's heart rate. Racing at 130 beats per minute. The nurse looked at me. Her face was pale. No heartbeat, she whispered. Anastasia heard her. Of course she heard her. The drape couldn't block those words. Why isn't there a heartbeat? She screamed. Why is it silent? Find him. Please find my son. I turned to the anesthesiologist. General anesthesia. Now. We don't have time for anything else. He was already drawing the medication. Anastasia reached out from behind the drape, her hand grasping at air. Doctor, please. Don't let him be born dead. I prayed for one more heartbeat. Just one more. I held her hand until her eyes closed. Then I picked up the scalpel. The scalpel moved before my brain could catch up with my hand. That is what training does. When fear tries to freeze you, your fingers remember what to do. Horizontal incision. Low transverse. Through the skin, then the fascia, then the muscle. I called for suction. The amniotic fluid that spilled out was not clear. It was stained green. Meconium. The baby had passed stool inside the womb. A sign of distress. A sign that he was fighting. I reached into the uterus. My hand found his head first. So small. Smaller than any 28-week baby I had ever delivered. His skull fit perfectly in my palm. I felt for his neck, his shoulder, his arm. Then I pulled. He came out limp. Completely limp. No crai. No movement. No flexion in those tiny, paper-thin arms. The umbilical cord was wrapped around his neck once. Loose. That wasn't the problem. The problem was the cord itself. It was thin as a drinking straw. Pale. Twisted. A failing rope that had been starving this boy for weeks. I clamped the cord and cut it quickly. I held him up for the pediatric team. He was the color of a rainy sky. Blue-gray. His eyes were closed. His chest was not moving. 1 minute. The nurse called out. The pediatrician took him to the warmer. A tiny body under the bright lights. His legs were so thin they looked like folded paper. His belly was concave, sunken in, because there was no fat beneath the skin. He weighed 820 grams. Less than 2 pounds. Start compressions, the pediatrician said calmly. A nurse began pressing on the baby's chest with 2 fingers. Another nurse placed a mask over his face and squeezed the bag. Oxygen rushed into his lungs. Nothing. Epinephrine, the pediatrician ordered. The medication went into his umbilical vein. A tiny dose for a tiny heart. 15 seconds passed. 30. Anastasia was still unconscious behind the drape. She didn't know that her son had been born silent. She didn't know that we were fighting to bring him back from wherever he had gone. I stood at the foot of the table, my gloves covered in blood, watching the team work. I couldn't help anymore. My job was done. Now I could only watch. And hope. And pray to a God I don't always talk to. 1 more round, the pediatrician said. And then, between the compressions and the breaths, the baby's hand moved. Just a twitch. A small opening of those blue-gray fingers. The monitor beeped. A heartbeat. Slow. Weak. But there. He's back, the nurse whispered. I closed my eyes. And for the first time in 20 years, I cried behind my surgical mask. The clock on the wall said the baby's heart stopped for 7 minutes. 7 minutes from the moment the Doppler went silent to the moment that first weak beep appeared on the monitor. But inside that operating room, time stopped existing. There was no past. No future. Only the present moment. Only the sound of the bag squeezing air into those tiny lungs. Only the sight of 2 fingers pressing down on a chest smaller than my fist. 7 minutes is nothing in a normal life. It is the time it takes to brew coffee, to scroll through your phone, to brush your teeth. But in that room, 7 minutes felt like 7 lifetimes. I watched the pediatrician's face. She never panicked. That is what makes a great doctor. Not the absence of fear, but the ability to hide it completely. Her eyes were focused, her hands were steady, and her voice was calm as she gave orders. But I saw her jaw tighten when the first round of epinephrine didn't work. I saw her glance at the clock. I saw her calculate the odds. After 3 minutes, the baby's color had not improved. He was still blue-gray, still limp, still silent. The nurse doing compressions was sweating through her cap. Her arms were shaking from the effort of pressing gently enough not to break his ribs, but hard enough to move his blood. After 5 minutes, the anesthesiologist looked at me. He didn't say anything. He didn't have to. We both knew that 5 minutes without oxygen could mean brain damage. Could mean cerebral palsy. Could mean a lifetime of struggles for a baby who had already fought so hard just to be born. I walked over to the warmer. I don't know why. I couldn't help medically, but I wanted to be close to him. I wanted him to know, somehow, that someone was there. That he wasn't alone. His eyes were closed. His mouth was slack. He looked like a doll. A broken doll that someone had thrown away. 1 more dose, the pediatrician said. And then, just as the medication went in, his fingers curled. Not much. Just a small bend at the knuckles. But it was movement. Voluntary movement. A sign that somewhere deep inside that tiny body, his brain was waking up. The monitor beeped. The pediatrician exhaled. We have a rhythm. It's slow. 60 beats per minute. But it's organized. The nurse stopped compressions. We all watched the screen. The beeps were far apart. Too far. But they were there. Each one a small victory. Each one a whispered promise. I looked at the baby's face. His color was changing. From blue-gray to a pale pink. From a storm cloud to a dawn sky. He was still not crying. He was still too weak to breathe on his own. But he was alive. He was here. And 7 minutes of silence had not stolen him from us. I walked back to Anastasia. She was still unconscious, peaceful behind the drape. I touched her forehead. Your son is alive, I whispered. He is so small. And he has a long road ahead. But he is alive. A single tear rolled from the corner of her closed eye. The NICU is a world of sounds. Beeping monitors. Hissing ventilators. The soft hum of incubators. And underneath it all, the tiny cries of babies who are fighting to stay in this world. When Anastasia woke up from surgery, the first thing she asked was to see her son. I wheeled her bed down the hallway myself. The nurse offered to do it, but I said no. I wanted to be there when she saw him for the first time. The NICU is on the 4th floor. The elevator ride was silent. Anastasia was staring at the ceiling, her hands folded over her belly, which was now soft and empty. She looked lost, like a ship without an anchor. When we got to his bedside, she gasped. He was lying in an incubator, surrounded by wires and tubes. A ventilator was breathing for him. And 4 line ran into his umbilical stump. Monitors were taped to his chest. His eyes were covered by a sleep mask to protect them from the lights. He was so small that his diaper was the size of a postage stamp. He's a scrap, Anastasia whispered. Just a scrap of a boy. I put my hand on her shoulder. He's a fighter. Do you know what he did in the operating room? His heart stopped. And then he started it again. He chose to come back. She reached her hand through the porthole of the incubator. Her fingertip touched his leg. His skin was translucent. You could see the blue map of his veins underneath. Hello, my son, she said. I'm sorry I couldn't feed you enough. I'm sorry my body failed you. The baby moved. Just a small stretch of his arm. But it was enough. The weeks that followed were hard. Harder than anything Anastasia had ever done. She pumped milk every 3 hours, even though he couldn't eat yet. She sat by his bedside for 12 hours a day, reading him stories, singing him songs. She learned the names of every nurse, every machine, every medication. There were setbacks. An infection that spiked his fever. A breathing tube that had to be reinserted twice. A day when his weight dropped instead of rose, and Anastasia sat in the family lounge and cried until she had no tears left. But there were also victories. The day he breathed on his own for 1 hour. The day he took milk from a bottle for the first time. The day he opened his eyes and looked at his mother. Moments like this remind us why these stories matter. Why we sit with the fear and the pain and the uncertainty. Because sometimes after the silence, there is a heartbeat. After the darkness, there is a face. After 9 weeks in the NICU, Anastasia carried her son out of the hospital. He weighed 4 pounds. He was still small, still fragile, but he was going home. 1 year later, she sent me a photograph. It sits on my desk to this day. A chubby baby boy with massive brown eyes, sitting in a high chair, wearing a birthday crown made of construction paper, eating a cupcake with both hands. His face was covered in blue frosting. He was laughing. On the back of the photograph, Anastasia had written, "Thank you for not giving up on a scrap of a boy."